like to call the August 19th, 2014 Finance Committee meeting to order. Chair would entertain a motion for the consideration of claims.
Yes, I would move for the consideration of bills to be paid in the amount of $1,486,961.57. On credit card in the amount of $2,544.70. Payroll liabilities for August 8th, 2014 in the amount of $414,423.05 for a total of $1,903,929.32.
Second.
And questions on the bills?
Your Honor? Just noticing that it seems like there's quite a few over budget items as far as construction contracts that are going on, especially through YDOT. Is that expected to continue is that kind of finishing off some things, or where are we at?
Mr. Chair, Councilman, what has happened on those projects, they were budgeted over the 2 fiscal years, and you probably saw in that note that last year we had a number of funds left unspent. Basically it was due to the construction schedule, and also I think we're just susceptible when YDOT submits those invoices. And so what it is we just probably didn't budget enough for this fiscal year in light of the fact that we hadn't totally fulfilled what was budgeted last fiscal year. What I've done is I've directed staff to get an approximation from YDOT on the remaining balances for these projects so that we can know exactly how much more we're going to have as far as bills coming in for this fiscal year. But it's just something where we budgeted for 2 fiscal years and didn't quite use everything from the last fiscal year, and didn't roll that over for this fiscal year.
Yeah, Your Honor, it's not that we don't have the money or we didn't have it. We're not going over on these projects. It's simply that when we developed the budget back in April, we thought, for instance, on Riverview, that most of that project was going to be completed before the end of the fiscal year. Well, it wasn't. And so what we should have done is probably carry over all those numbers that were unexpended, but we only put in what we thought we'd have to spend. The money was always there, so it's not that we're over, it's just that the money's there in the bank, it wasn't budgeted for.
It's going to come out of surplus then, is what you're trying to say.
Yeah, it was just carried over from the previous year, and that's always a problem in these multi-year projects or through fiscal years, because you estimate what you think is going to be the amount that you need for that year, and if things don't go as planned, then you have a lot more in the next fiscal year, which puts you over.
That's it for me.
Okay, any other questions? And that covered all my questions too. So all those in favor of the approval of claims say aye.
Aye.
Those opposed, motion carried. Is there any other business for us tonight, Mr. Weaver?
No, I don't think so. You've probably seen the memo on here about Sherman-Williams. Sometimes we get invoices, we get statements, and we get other things, and they kind of double billed on that, and so that's why we took those off.
Okay. All right, if there's no other business, meeting adjourned.
2014 regular meeting of the Riverton City Council to order at 7 p.m. Would Councilman Fabian lead us in the pledge, please?
Thank you.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Would the acting city clerk please conduct the roll call?
Yes, Your Honor. Councilman Richgard.
Here.
Councilman Martin Canan.
Here.
Councilwoman Mary Ellen Christensen.
Present.
Councilman Jonathan Fabian.
Here.
Councilman Kyle Larson.
Here.
Councilman Todd Smith.
Here.
Mayor Ron Warpness.
And I am present. Thank you. I declare that we have a quorum this evening. The chair would entertain a motion for the approval of the agenda.
Your Honor, I move to approve the agenda as presented.
Second.
Been moved and seconded. Is there discussion? All those in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Communication from the floor, citizens' comments. Anyone in the audience wishing to address the council regarding an item that is already on the agenda will be given an opportunity to speak later on. I would ask those individuals who wish to address the council at this time to approach the podium and identify yourself for the record.
I'm Judy Ann Woolery. I live at 514 North, 16th East.
Are you going to be speaking regarding the rollouts and whatnot?
Later.
Later, okay.
I want to address the council regarding the weed infestation and the mosquito spraying control. Down on 16th, the mosquitoes are thick. I called the shop this morning. They told me that they don't spray down the alleys anymore. They only spray when it isn't raining or wind blowing or whatever. They could do that in the morning. It's thick down there. And she said they didn't have enough manpower or money to buy the product to spray. I want that looked into. That's ridiculous. That's one of our main things that we need in this county and this city. The other thing is the weeds are out of control. Several years ago, the city hired contractors to go out and cut the weeds down to those that didn't cut them down, and then they would charge that citizen to have them done. For some reason, it's not happening anymore. The other thing is we spend all these thousands of dollars on city beautification. There's weeds in between the sidewalks and the curb. There's weeds on the road. There's weeds in the backyards. You know, if homeowners can't do it, fine them, make them do it. If the house is unoccupied, then it needs to go against the property. But all it does is scatter the seed from year to year and every summer. And that is ridiculous. People won't even go out there on Main Street on that beautiful curb and gutter that we bought. And there'll be one weed in between. Do you think they'll go out and pull it? No. Around the trees that you planted, there are some businesses that won't pull the weeds. On Federal down here, the same thing. It would take a person maybe 5 minutes for one weed. But these businesses across here, they need to control their weeds too. If we're going to have a clean-looking town, then we need to either quit spending the big dollars and put it to somebody else the city hires to do it, or something else. That's what I'd like.
Thank you, Judy. Is there anyone else who would like to address the council at this time? Mr. Davis.
I'm Jim Davis with the Chamber of Commerce. I put on your stations our mid-year tourism asset dollar report as to how much has been actually remitted to the particular grant recipients and where we're at. We still have the rest of the year to finish these grants out, but our committee or our board requires a mid-term report, so I figure I'll pass it along to you guys and so you can see where we're at. If you turn to the last page, well, actually, let me explain the report. The first number in the yellow is the amount that the particular entity requested. The second one is how much was actually awarded, and then the third one is how much has actually been paid out in the green. And so if you go clear to the back page, we originally had $113,324.30 worth of requests. We actually granted $99,979, and at this point, as of 8/6/2014, we'd paid out $49,429.35. So we're about halfway through. And there's some that won't ever get the whole amount because they it's a projection on their part, and then the way we do it is they have to provide receipts to me for the money that they've spent before I'll cut them a check, so. I think most of you understand that this comes from the lodging tax that's collected in the hotels, and most of it's for advertising, promoting the community for all different kinds of events.
Are you able to carry over some of that money for the?
Yeah, we do.
through?
Yeah, we do.
Okay, I just.
We
noticed-
actually collect, the portion that Riverton gets is usually between $85,000 and $90,000 a year. So, yeah, we're gonna have a little carryover every year. And then what I do is I cut it off. I send out letters to people who haven't requested, their portion in December, saying that the deadline's coming up and you need to get the paperwork into me. And then we cut it off at the end of the year. If they don't get it in, it gets rolled over to the next year. And ironically enough, there are some that don't ever submit. They submit the paperwork to get the request, but then they never submit the paperwork to get the money. So I'm not sure they really needed it to begin with, but in reality, there's always some that do, and there's always a few that I have to remind every year to make sure that you get their paperwork in. And then we'll open up the grant period again, usually start the paperwork process in January, and then the committee will sit down in February sometime and allocate the funds for the next year and go from there. Pretty straightforward process, really.
Remind me again, what does that TAD stand for?
Tourism asset dollars.
Okay, I knew that. I've heard it 100 times, but I've
Yeah.
drawn a blank
Well,
on that.
Yeah, well,
TAD.
in a world of acronyms,
Yeah.
you kind of get that. Any other questions?
Anyone have any questions? Mr. Davis?
Thanks. Okay, thank you.
Thank you, Jim. Good job. Mr. Baker?
Lars Baker. I'm working with Fremont County Weed and Pest this summer. I'm running the mosquito trap line for the city of Riverton. We trapped last night. We have West Nile virus in the mosquito population in Riverton. So I'm grateful for the opportunity to use the community television as a way to publicize that information to some folks and maybe increase awareness and thoughtfulness about West Nile virus prevention. It's largely something that you have to do yourself. You gotta, not spend a lot of time out after dark. You gotta cover up, wear mosquito repellent, and pay attention to what's going on. This mosquito will come in the house if you let it, and it'll get you while you sleep. And so we do have West Nile positive test in that mosquito population. Probably for the city, the information is of value because this is what justifies the use of the extra money that you get from the state of Wyoming. Is the West Nile virus presence and the mosquito numbers that we have. And so I appreciate Mrs. Willery's setup for my presentation, that there's certainly an opportunity here in the past. Once we've gotten West Nile virus, we've gone to twice a week on mosquito spraying and been a little bit more aggressive about it. And that's certainly appropriate to do now that we have, we've got that detect. So we've got that testing data that supports that program as far as the Environmental Protection Agency is concerned. Do you have any questions?
Any questions? Thank you, Lars. I appreciate it. I've received a call just this afternoon from a lady that was expressing concern about the lack of spraying in her area, that the mosquitoes were eating her up as well. So thank you. Maybe we can do a little better job on that.
Your Honor,
Yes, Councilman Garden.
there's a really good article on County 10's leadoff, I believe, at least on my machine, on the collection and mosquito population, and also gives 5 or 6 steps on how to avoid and what to do to take care of that. So it'd be wise to look that up, pay attention to it.
Thank you. Anyone else want to address the council at this time? Okay. Chair would, we'll handle the consent agenda at this time. Would the acting city clerk please read the consent agenda items by title only?
Yes, Your Honor. Approval of the minutes, August 5th, regular council meeting. Approval of the minutes, August 12th, 2014, council work session. Approval of the minutes, August 19th, 2014, finance committee meeting. Approval of the finance committee recommendations for August 19th, 2014. Approval of the municipal court report for the month of July 2014. And the city clerk's office received 2 catering permit applications. The first one for LaPierre for September 13th, 2014, the Paws and Pearls fundraiser at the Heritage Hall from 5 p.m. to 12 a.m. And the second for LaPierre on September 27th, 2014, the Van Dyke Family Fundraiser at the Fremont County Fairgrounds from 5 p.m. to 12 a.m.
Your Honor,
Okay, yes.
it's the recommendation of the Finance Committee for the approval of claims to be paid in the amount of $1,486,961.57. Elan credit card in the amount of $2,544.70. Checks written for payroll liabilities for August 8th, 2014 in the amount of $414,423.05 for a total of $1,903,929.32.
Wow, it's a lot of money. The chair would entertain a motion regarding the consent agenda.
Your Honor, I'd make a motion to accept.
Second.
It's been moved and seconded to accept the consent agenda as presented. Is there discussion? All those in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Mayor votes aye. Introduction and oath of office for new officers, Tyler Larson and Sam Beecham. Chief of Police, report, please.
Thank you, Your Honor. Council, as you know, we like to introduce our public officers to the public and have them sworn publicly. We have been fortunate yet again to find a couple of just fantastic young men to join our police department, and I'd like to introduce them to you. To my immediate right is Tyler Larson. Tyler is a graduate of Riverton High School. He also has an associate's degree from Central Wyoming College, and he's married. Brianna, his wife, is here to pin his badge on. And next to him is Sam Beecham. Sam was an officer in Evanston for a year, so he's already been to the academy, which, by the way, Tyler leaves in a week to go to the academy. We're trying to figure out how we're going to have a baby around the academy, but we're working on it. Sam's wife, Jessica, is a state game warden, and she's here to pin him tonight. Sam's a sergeant first class in the National Guard. He has a deployment, at least one deployment overseas under his belt, and he's also got a bachelor's degree from University of Wyoming in criminal justice. So just a couple of fantastic young men, and they're doing great in the training program. We're really happy to have them.
Okay, thank you. Close enough to the microphone so the folks will be able to hear me. If you'll raise your right hand, and after I state your name, I
Samuel B. Tyler Larson,
do solemnly swear or affirm
solemnly swear or affirm
that I will support, obey, and defend the Constitution of the United States
I will support, obey, and defend the Constitution of the United States
and the Constitution of the State of Wyoming,
and the Constitution of the State of Wyoming,
that I have not knowingly violated any law related to my election or appointment,
that I have not knowingly violated any law related to my election or appointment,
or caused it to be done by others,
or caused it to be done by others,
and that I will discharge the duties of my office with fidelity.
and I will discharge the duties of my office with fidelity.
Congratulations.
Sir.
Welcome aboard.
Thanks, sir.
Thank you. Thank you, Chief. You're just continue to find outstanding people for our PD. I don't know how you do it, but we're getting some top people in there, and I really appreciate it. Okay, agenda item number 9, Fremont County Ambulance Update. Joe Zelmer.
Good evening, Mr. Mayor, council members. I am Joseph Zilmer, the Director of Fremont County EMS. You all were handed out a short little packet right before we started. I don't intend to go through that line for line. However, it is a document that you can refer to, which I'll try to hit the highlights for you. The main purpose for me being here this evening is there is a material change in the response capabilities of Fremont County EMS that affects everyone in the county, including the city of Riverton. And I wanted to highlight those points with you this evening. After the last budget session, we had to make some cuts to meet the requirements that we were given, and those cuts primarily were brought out of FTEs or full-time equivalents. The original budget cuts put forth a total of 7 reduced staff members from the ambulance service. Of those, 4 were from the Lander division and 3 from the Du Bois division. Now, since the first budget approval, the county commission approved approximately $165,000 from the general fund to reinstate the single ambulance that is currently operating in Du Bois. Now, what we did in the staffing in Lander for the last, I think, and Todd, you correct me if I'm wrong, I think for the last 4 years, the staffing patterns for Fremont County have been fairly static, and by that I mean there are 2 24-hour ambulances 7 days a week in Riverton. There have been 2 24-hour ambulances 7 days a week in Lander, and then there's been a somewhat modified ambulance in Du Bois. Well, as of August 1st, we reduced 1 full-time ambulance out of the Lander division. Now, instead of 2 24s, we have 1 24-hour shift, 7 days a week, and we have a 14-hour advanced life support ambulance that operates 4 days a week. The days we chose to operate that ambulance was based upon historical demand patterns that we evaluated that indicated to us statistically when we could expect calls to come in. All we have to judge that on is historical data. We went back about 4 years looking at that data, all the way down to the hour of day, day of week, and week of month. So we have seasonal patterns as well as annual patterns. Now, materially, here's how it will affect Riverton. If we are in a situation whereas we're on one of the days in Lander where we have only the 1 24-hour ambulance, and that unit is engaged in a response, we will move a Riverton ambulance to the Hudson area. And they will stage there until that other ambulance is frees up and is available to take other calls. That is the only pattern we have to best cover the county with the resources we have available to us. What's the net effect of that? Well, there will be certain times that there will be a call for an ambulance in Fremont County that one may not be available. Now, historically, I can't tell you when that would be or how it will be, but most definitely it will probably occur a few times a year. That being the case, the city of Riverton, if it happens to be in the city of Riverton that you are waiting for an ambulance, it will put in additional burdens on the police department, simply because they respond to a great majority of our EMS calls, if not all of them. So if we are unavailable and we're waiting for an ambulance to free up or come from some other farther point in the county, it will require a police officer to stay on the scene longer when they can normally clear within 6 to 8 minutes. This whole scenario evolved over time. This wasn't something that happened overnight. Healthcare reform and reimbursement has accelerated over the last 24 months to unprecedented levels. We all know what those are. They're called the Affordable Care Act. And what that has done effectively is it has reduced reimbursement. As an agency, truly about 52% of all the monies that we capture are from federal agencies, i.e. Medicare, Medicaid. As of April of next year, if the rules go in as intended and as President Obama said that they would, Fremont County will receive a 23.2% reduction for Medicare reimbursement over what we're being paid now. If that happens, that will essentially take out over $400,000 in revenue that we currently receive. That is one of the mitigating factors. The other factors are, and understand, this agency at the beginning of the year had about $1.2 million in what is called an enterprise fund, rainy day fund, additional monies that were available for the agency. That fund captured dollars by simple straight line depreciation over a number of years. It was an accounting move where money that was paid in depreciation goes into that account as a credit to be used later. This year's budget is requiring us to use every dollar of that, a little bit over $1 million. And that is with us having reduced staffing of what's been in the last 4 years. Raising the rates will not work. We're already at the maximum that Medicare will reimburse on a particular call. So if we reimburse the rates, it will mean a higher bill for private pay and for private citizens that a lot of them can't afford to pay now already. We have an IHS contract that is now 7 years old. We are renegotiating that. We're attempting to do that right now. That pays about 38 cents on every dollar that's utilized. In the last 7 years, over $2 million have been written off for services rendered. I have been told that funding has been cut to the Indian Health Administration or Indian Health Services. So for us to capture any more money from that appears to be a hope and a dream at best. So what it boils down to is that we're on the tip of the spear of healthcare finance. And it's important that you as Riverton leadership and government, as it was with the city of Lander, as it will be with the city of Du Bois and everyone else we're involved with, that you need to understand the dynamics of what we do and how we do it and how much it costs. One of the reasons why our budget was so extreme this year is the portion of benefits that are paid to the employees mandated by the Affordable Care Act with health insurance and other things went from a little bit less than $300,000 last year to over $800,000 this year. That's a net effect drag on the bottom line that we have no way to compensate or make up for that unless it's in user fees or subsidies. For us to maintain the current service levels that we have right now, next year's budget will require an additional $1.2 to $1.9 million just to sustain what we're doing now. It's a very difficult situation for sure. So what has to be done now on this level and every level is there needs to be a consensus or at least a discussion with everyone that's involved in this county entity, this agency, on what priority does EMS have in the county. There are mill levies that are attached to various things in the county that are very important and nice to have. However, I would question most of those do not provide the critical need and service that EMS does provide. There are other ways for us to try to attract more funds and revenue. We've hired a full-time grant writer to try to facilitate as much money as we can possibly garner from every source we can find, both government, private, state, local. I don't know, we've got 5 or 6 grants out right now, and we just started this in the last 60 days. We have no idea what the result or the harvest will be from those grants. We know, obviously, we can't depend upon them, but at the same time, we are dependent upon them to a large extent. What I'd like to do, and I have statistics, very specific statistics that are in there that I'll be happy to answer questions about. Another thing that a lot of people don't know, they don't consider what EMS does. I mean, they do, but they don't. They know if they pick up the phone and call and they need an ambulance, that they have an assurance that an ambulance will show up there relatively quickly with well-trained people that will do the right thing, treat them effectively, regardless of ability to pay, color, or creed, and get them to the hospital. That's a reasonable expectation. That is a legal community-based standard of care. We have that here. We've had it here for a number of years. One of the other issues we face, we did a little research from 1st of April of last year till the end of March of this year. And we extracted data for people that called us at least 4 times in that 12-month period. Now, it did not capture the people that called 3 times or less. These were what we call repeat callers. There were over 1,250 of those. Over 800 of those were alcohol, drug-related main complaint. We had some people that called us 25 times in a year. We had several people that called us 20 times in a year. We had one particular patient that lives about 12 miles out of town that called us 18 times. We got there 18 times and they refused to ride. Now, this becomes much more critical now because our assets are very valuable. For us to be tied up running these type of calls creates a hardship for those people that really do need an emergency ambulance. And I think in the past there has been a mindset that if someone wants to go to the hospital, they call 911 and they get an ambulance and the ambulance transports them. That has to stop. I mean, it has to stop. Literally, there has to be a discernment at some level, at some point, that the patient that calls truly is not in a life-threatening situation where they require a role in the emergency room to take care of them and transport them. There are a lot of ways to address that. We have to do it clinically in the way we evaluate, but we also have to figure out a way to hold people accountable for 911 abuse. Communities do this every day across the country. It's one of the things we have to address. Another thing that I'm hoping to do is, well, we are doing it actually, is we're forming an EMS Sustainability Committee. And you will be getting, Mr. Mayor and Councilman, you'll be getting your invitation in the mail tomorrow, inviting you to pick 1 or 2 representatives to meet every 6 weeks with other representatives from the city of Lander, police, fire, hospital, a physician at large, so that we can start now on the 2015-2016 needs assessment that we know are coming down the road and what our shortfalls probably will be. I think that every stakeholder that's involved in this county needs to get involved in EMS to some point, and the decision needs to be made on how the agency will be funded and how it will proceed. The only thing we can do to cut out expenses is to lay off people, and we've already done that. When we do that, there's a negative effect. There's a potential for a huge liability that we are trying to avoid as best as we possibly can. We don't have all the solutions, but I'm hoping with the infusion of talent and wisdom that we hopefully can attract to this committee, that we will find some ideas that are appropriate to how we move forward. There are other areas, much like Fremont County, that have 2 metropolitan areas of some size in a county government, that they mutually accept the funding on the shortfalls for EMS. That's not popular. It won't be popular with you guys. It won't be popular with your citizens. But the reality of it, it has to be addressed one way or the other. And I'm not here to bring you bad news. I'm here to be proactive. I'm here to tell you we've already crossed the line of where we need to be. And let's collectively get together, find solutions, and work out a way to move forward in the future. The clinical levels that we establish are good. We have the highest trained personnel that the state recognizes: paramedics, RNs, intermediates, EMTs. The quality of care is good. The effect it has on truly critical people is life-saving. Study after study will tell you that a paramedic with full medication capability can save someone that's having a heart attack. An EMT cannot. Some intermediates cannot. So these critical distinctions between level of care and what can be done are well documented. And it is a clinical standard that the state of Wyoming has embraced. And this agency was following along those lines long before I got here in February. So of course we want to try to continue and maintain those high standards, but like everything in healthcare, it comes at a very high cost. That's where we are. If we can find additional funding and grants that will permit us to use it operationally and be compliant at the same time, we will reinstate the second 24-hour ambulance in Lander. We don't know when that may or may not be. Another dark side of all this is when we're down that second 24 in Lander 3 days a week, it essentially doubles the workload for that Lander ambulance. But it also doubles the workload for one of the Riverton ambulances. Because at 2 in the morning, if they have to go way out west on an auto accident or go on the reservation, a crew has to get up out of their bed in Riverton and go post in Hudson so that we have the best coverage we can possibly have. So it affects everyone, not just Lander, but Riverton as well. So that's a situation we're in. I ask that you join all of us in addressing these issues and try to find solutions. That's where we are. We've got a year head start on this now, guys. A 1-year head start. We have adequate time to look at all potentials and possibilities to find the best solution to make this work. Do I have any questions from anyone, Mr. Mayor?
Thank you, Mr. Zillmer. That's, yes. Councilman Larson.
Of these, you had 1,287 calls.
Yes, sir.
You had 886 calls that were alcohol related. Were they emergency, or were they heart attack, or were they critical care?
Every one of those 800 plus calls were emergency calls. We responded lights and siren, but they were drunk or high on drugs. Now, everyone that is drunk or high on drugs have secondary medical problems, especially if they've been doing it for a long time. We realize that. But what we have to figure out is is this just another case of intoxication where they don't need an ambulance and they can find a different way to go to the hospital or to rehab if they want to go, as opposed to tying up one of our critical care assets that someone's going to need later down the road.
Okay, but my next question was, of that 1,287, how many of you say there was a person that had 18 calls? How many total calls were refused when you got there?
Of that particular, these particular
Non-writers.
Right, I understand what you're saying. You're talking about call cancellations or refusals. On these type of calls, it's less than 10%. Majority of
So you would say 128?
Oh, yes, yes.
Are you mandated to respond to clients that don't pay you full fare?
Yes, sir. We do not discriminate. The nature of our business.
No, I didn't say if. I say, are you mandated that people that don't pay, I mean, in my business, if you don't pay, you can't stay?
Right. No, sir. Anyone that calls 911 and requests an ambulance, we respond to.
Okay.
That is the requirement.
Thank you.
Yes, sir.
Any other questions?
Your Honor,
Yes. Councilman Christian.
and maybe I didn't get this, if you could explain to me again. So if this plan were to come around, the second ambulance in Riverton goes to Hudson, leaving one ambulance in Riverton to cover, the Highland, essentially, and to Boyson, and to,
All points east.
all points
All
east.
points east. Yes,
Okay.
ma'am. That is correct.
So that would include Riverton to,
Yes, ma'am, it does. And see, that's the net effect that, Lander, of course, had the immediate impact of being down that crew locally. But what everyone needs to understand, that the whole county is affected by this. When those dominoes start falling, our whole response plan has to change. We have to stage and move people around so that we can get to most of the county as quickly as possible at that particular time when assets are engaged. This is system status management. It's what ambulance services do.
Your Honor,
Yes, Councilman Garden.
how often, do you have an idea how often all assets are in position and being used?
That's a good question, Mr. Councilman. We have run some data on that, but unfortunately right now we do not have accurate data collection from the 911 center. They are working on that. Condition yellow is when everyone is engaged. Condition red is when everyone is engaged and there's 911 calls holding. In the last 3 or 4 months, what would you estimate? 20 times?
20 times easily on yellow, and usually when they're in yellow, we're either getting one finished up as another 911. And we have a call average between every 45 minutes
Can you come up to the microphone so that the folks at home can hear your response, please?
Yes, sir. I would agree with Joe's data, probably 20 times plus in a monthly period. We average about 500 calls a month, every month consistently. And that call volume hasn't changed over the past 4 years. That's why we put the dynamics of the structure of the 2 24-hour crews in Lander and the 2 24-hour crews in Riverton. We get a call approximately every 45 minutes, but as is the case with Fremont County, you don't get a call. It's not like, 45 minutes, we're going on a call. We get 4 or 5 of them at once. And that's just kind of the nature of the beast that we have within Fremont County. There are peak times and highlight times, and there's just seasonal peak times that we have throughout the year. So it's a very tough beast to say, well, on Monday we're not going to have 4 calls for service, and eventually we do. I mean, we had a ambulance in Hudson today that had to respond back over to Riverton for a patient that had a traumatic injury. We went as a supervisor, went out on the call, and that's what we're trying to do to kind of get that interim, to at least get some type of patient care there, have a paramedic response vehicle or an ALS response vehicle go to that scene. But if I'm not available or I'm tied up on another emergency, then that unfortunately is going to have to stack up and wait. So it is kind of a logistical problem. And that's not taking into account when we have to send a transfer out of the county, which, as you know, we do send a tremendous amount of transfers out. And I do applaud Sage West. They're trying very hard to keep patients here. But unfortunately, due to the critical nature, comorbidity issues, the disease processes they have, some of these have to go to a higher level of care.
How many ambulances do you have in Riverton, Lander?
We have a total of 4 ambulances at each station. We have 2 in Riverton that are manned 24 hours a day, 365 a year. Now, currently, we have 1 in Lander that's 24 hours a day, 365. We have that floating shift that comes in during our peak hours, which it's doing the best you can with the statistical data that you have. And that comes in at about, I believe they come in at 10 o'clock in the morning, and they work till 1 o'clock in the evening. But that crew many times has stayed till 4 o'clock in the morning because the calls just keep coming out. So, we can't deny it. To answer your question, sir, it's called duty to act. We do have a duty to act when we're responding on a 911 ambulance. It's federal law.
What days have you found? You alluded to the fact that there are certain days that are
Yes, sir.
Are busier than others?
Yes, sir. Typically, Monday, Tuesday, Wednesdays are our slowest days. Tuesday and Wednesdays being the slowest. However, that statistical graph used to look like this. It's almost a straight line now. It's just really hard to pick the 2 days. Those are our least call volume days, is Monday, Tuesday, Wednesdays. But as we've found since we've implemented this, we've been having to send ambulances all over the county and occasionally try to get some extra crews to come in to help out with some of the transfers and things. It's just
what are the options when you find a call that is wasting your time? What are the options?
As a medic on scene, obviously you try to get it done as expeditiously as possible. I don't want to say that every call is wasting our time. A lot of these people that are on drugs or they have a high BAC, there's a potential risk to them. So you have to evaluate your patient. And that's just managed within a call volume. I mean, that's a structure. That's what we do, okay? We come on scene. We evaluate the patient. Do they need transported? Do they not? If they need transported, we take them to the ambulance. We try to limit our scene times to 10 to 15 minutes so we can get that turnaround on those ambulances. And we're very diligent about that. Adding that paramedic level, and especially some of the very seasoned paramedic levels, paramedic individuals that we have in here, have really strengthened that process within our agency.
Thank you.
You're welcome, sir. Thank you.
Councilman Canan.
Sir, I would assume, since, the Affordable Care Act, the losses in Medicaid, Medicare funding, your increased benefits. So I'm assuming that this isn't a Fremont County unique type problem. Is there any type of, I want to say, a group or thing where you're getting the various other counties together to brainstorm, come up with ideas, kind of fight it as a whole, as opposed to, county by county?
Yeah. Mr. Councilman, yes, there's been some discussions about a state buying group to buy medical supplies and things like that. As far as a pool for health insurance benefits and those sort of things, those are county specific. And being county employees, we're under the plan. The county has to provide for us, just like they do every other county employee. So we're kind of limited in what we can do with that.
Thank you.
Any other questions?
Your Honor.
Councilman Fabian.
You mentioned that there's places that hold people accountable for 911 calls that are unnecessary. How does that work what types of things are done?
Well, what's normally done, there's statutes written locally on a city level, that if we have repeat offenders, that we have the same people calling all the time for the same things, they're usually given a warning, and then if they continue to do it, they're fined, and sometimes they're jailed if they do it multiple times. So it's a stern message to send, but at the same time, it's necessary. There's system abuse in all 911 systems. It's rampant. People that don't have the money to go to the doctor, but don't want to wait in the emergency room, they know if they call an ambulance, that'll get them to the front of the line. That's the realities of healthcare. They'll get a bed because they know we can't leave them on our stretcher till they get seen. We have to clear our stretcher, get back in service, and get on the road. So we're left with the task of mitigating that time down and that abuse as succinctly as we possibly can.
Any other questions? Thank you, Mr. Zilmer. We appreciate your coming in this evening, and we'll look forward to the information and opportunity to leap into the fray and help.
Thank you, Mr. Mayor, Council. I
Thank
appreciate
you.
it very much.
Okay, agenda item number 10, public intoxication update. Chief of Police Broadhead.
Thank you, Your Honor. If I can just have a second to get this set up, please. Thank you, Your Honor. I just wanted to present some good news this evening. We've been hearing a lot about some problems. I'm sorry, Ms. Rogers. I should have warned you before I put that right in your face. And so I wanted to just briefly discuss, as a very quick presentation I put together, but just to give some positive news about where we're at with public intoxication, where it's headed, and what I think is happening, and why that's happening. So in May of 2012, just to take you back, I hosted a forum to discuss issues related to public intoxication in Riverton. And at that meeting, I basically expressed that what we're doing is not working. What we've been doing for 50 years is just not working. I think we can advance that, Kristen. And that it was going to take a multidisciplinary and multifaceted approach to trying to fix the problem. What we had been doing historically is trying to arrest our way out of it, and it just wasn't working. And so there are a lot of people who stepped up to the plate for that. We had several meetings. After that meeting, a solutions committee grew out of that. My intention all along after that was, again, not to run the solutions committee, because that's a police answer to the problem. And I wanted to really have the community find better ways or different ways to treat these issues of public intoxication. And so here's some of the groups that really stepped up and have been helping. Kelly Reese is here from Prevention Management. They do a lot of education and training, and they run the TIPS program throughout the county to try to educate our alcohol servers on over-serving and those kinds of things. The Solutions Committee, which was what grew directly out of that May 2012 meeting, and I chaired that for a little while, but I was looking for someone else to step up, and Charles Aragon, who I saw him here for a while. Charles is the chairperson of that for over a year now. And they took a much more clinical approach to that, and I think some good information is coming out of that. He's really formed a good group that involves people from throughout the county, from the reservation, who are really trying to find creative ways to address these kinds of issues. Volunteers of America, of course, has been huge, and we're going to see some graphs here in a minute about what I think their impact has been. But they have some folks here. Dana Flint is here. Dana really was one of the pioneers with Charles of trying to go out into our public spaces and really get to know the folks that are using our services the most, and trying to find out what the underlying issue is. She really came up with this idea that there's a three-tiered problem, which is not just alcohol abuse, it's also homelessness and mental illness, and how those three play together. And so she's been trying to address all three legs of that stool. She administers a grant through VOA that is the PATH grant, which is really dealing with, specifically with homelessness. She calls me when she finds people who have found their way to Riverton from other points on the compass and have no support here, no family here, and she works really hard to reunite them with their families in other places where they can get some resources rather than just be homeless on our street. Rhonda Schiefer is next to her. Rhonda's a clinician, and she works directly at the Center of Hope and is holding groups with folks and meeting with them and really trying to get them on the path. One of VOA's, and Shelley sorry, I can't say that. And Shelley has been with the Alcohol Crisis Center for a long time. As you know, it became the Center of Hope as a name change, but also as a philosophy change. And their goal really is to measure success in weeks rather than overnight stays. And we heard this complaint a lot that the center, I call it the Detox Center still, even though its formal name is the Center of Hope, that they were a bed and breakfast. And they understood that, but they were in the business of critical care, of just trying to save people one day at a time. And VOA has come up with a whole new plan and method, and I think it's been very successful. I mentioned the Path Grant already. Noel Cooper's here. Somehow I don't know how to spell Rio-Surces. I'm not sure what that is. Wish I had noticed that before. Just right now. Noel Cooper's here from Injury Prevention Resources. As you know, you fund that through the budget. You provide them with some funding. They do some DUI probation for first-time offenders and maybe some second-time offenders. Education. They're out doing everything from bicycle rodeos to ankle monitoring and alcohol monitoring. And that certainly has a piece of that. Of course, the police department cannot divorce itself from the issue. We're always going to have a piece of it. I just don't feel like we can be the solution. And of course, the courts, Judge McKee works with me very directly to try to find solutions. She's as frustrated by repeat offenders as everyone else. And also the probation and parole department and the drug court. And there's all these folks who really are trying to address the issue. We have people from different disciplines, treatment counselors, law enforcement, homeless specialists, prevention specialists, and mental health experts. All are working to try to address the issue. And so let's look at what I think the impact has been. This first graph, really, this blue line at the bottom, those are the people statistically that have been taken to jail just for public intoxication by the Riverton Police Department. And you can see from 2009 until 2014, that number is sort of flat, but starting to decline a little bit. We see just a little bit of a rise here because we have less beds for crisis care, obviously. As we transition those beds at the detox center into longer-term beds, we have less beds, which gives us some less options, which we talked about a year ago or a year and a half ago. We knew that was going to happen. The increase has been much less than I expected. If you see this 2014, remember right here I have an asterisk by it. These numbers are all annual numbers on a calendar year, January through December. That 2014 number is a year from July 2013 through the end of June 2014, because that's the first full year of VOA's operation, right? So those numbers are a little bit different, but I wanted to show the impact the VOA is having. This next line on the graph right here are the people that have been taken by our police department to the Center of Hope or to the Alcohol Crisis Center. And as you can see, that number under VOA's care has plummeted, right? We have, if you look at the overall number, which is this top, which is essentially just arrests for public intoxication and trips to detox, this is just added together to make this overall number. And you can see the decline happening. We are taking over 2,000 people a year to one of those two places just for being intoxicated in public. And as you can see, this number now, over the year that VOA has been in charge of that center, are dropping pretty close to 1,500. We've seen about a 450 person reduction just in the last 12 months from them. So this I thought was interesting because I like the steep decline. This is the same numbers. So this is arrests for public intoxication, trips to the Center of Hope, and total. In the single month of July 2013, the first month that VOA took over at the Center of Hope, that's 180 folks that were transported by our police department to one of those two places. This now is a snapshot of the same month in 2014 after they've been in production for a year over there now. And you can see we had a 50% reduction. I realize statistics are what they are. That's 1 month in a snapshot to another month, and statistics can say lots of things. But I like the graph before showing a decline, and then this month is showing that decline should continue to plummet. You know, VOA, when they came in, Heath Steele, who's one of their directors, really said, how are we gonna measure success? And he said, if we can do about a 5% reduction, we're gonna call it success. This month at least has been a 50% reduction. I don't know that we can expect that to continue, but I'm encouraged by it, and that's the message I wanted to have for you this evening. So there's other factors of public intoxication I think we need to discuss, and that is the issue of driving while intoxicated. People are intoxicated, moving through our public spaces in our cars. And as you can see, these are DUI arrests from 2009, declining each year. And 2013 is the last full year, but we were below 150. Now that number could be manipulated, could it not? We could say that the police department's simply not motivated to arrest drunk drivers. And so we can manipulate this number by just arresting fewer every year. So we have to zone out a little bit and look at alcohol-involved crashes in our community. If the police were just not enforcing DUI laws as effectively as they had been previously, we would expect to see a corresponding increase, would we not, in alcohol-involved crashes. These numbers come from the state, from the highway department. This number at the bottom, and again, these are just City of Riverton alcohol-involved crashes. These are fatalities. As you can see, the statistical numbers are very low. We had 2 in 2010, 2 in 2011, and we didn't have any in 2012 or 2013 in the city limits. This next number is the number of alcohol-related crashes in the city that had injuries involved. And then this next graph up are property damage-only accidents. A PDO accident for us means that there's been at least $1,000 in damage to any one vehicle or someone's property, and there was alcohol involved as a causal factor. 2010, we saw a pretty steep decline in that number. I don't have an explanation for that other than to say that, you know, again, statistically, maybe December of 2009 was really bad, and January was pretty good, and we got a little bit of a statistical bonus there. If we look at this over a trend, I think you see that those numbers start to decline as a whole in the city. And this is the overall. This is PDOs, fatalities, and injury accidents. And you can see that this overall number is actually below even that statistical decline in 2010. So now if we scope out a little bit more and we look at the entire county, obviously the city only has a piece of the county's impact. You know, our numbers are pretty small. 2 fatalities, you know, if you have 4 in a year, it looks like you've had a 100% increase. It's a little bit difficult to look at. Well, I want to look at and see how are we doing countywide. So same kind of numbers, but countywide. Fatal traffic crashes involving alcohol, you can see that's on a decline. Again, we're not talking huge numbers, but that's a tremendous impact on a family. We have injury accidents in this blue line right here that are alcohol involved in the county, and then the property damage only accidents. This is a strange one to me. Typically, you would see fatalities, fewer injuries, and then fewer yet of the other direction. You'd always have more property damage accidents because those low speed crashes. We actually have countywide. In 2012, we had more injuries from alcohol-related crashes than we did just property damage only. But again, if you look at the totality of those crashes, again, I think that we're on a pretty good arc, that we're heading down. I think that's a real positive message. So that's the quick message this evening, is that we hear so much negativity and so much bad news. You know, during the county fair, I was driving up and down the bike path on a borrowed 4-wheeler that we got, and I couldn't find a drunk person. I actively was looking to clean them up off the bike path, and I couldn't find one. I went to City Park repeatedly this summer and could not find intoxicated people. Not to say they're not there, we're still making arrests and those kind of things, but it's going down. I ran into 2 of our swing shift officers. They were sitting in dispatch, and it was about 5:30 in the evening, and I went in and I said, hey, what are you guys doing? And they said, you know, we just were reflecting that typically when we came on to swings at 4 or 5 o'clock, we would spend the first 2 hours chasing drunks, just getting them, as people were getting off work, they were calling in intoxicated people that they found as they're locking their business. They're just not doing that because we're not getting those calls or they're not locating those folks. I took that anecdotally, again, as a very positive message. That's what started me on the quest if statistically we can back up what we think we're seeing anecdotally. So overall, our trends are positive. And I think that thanks to these folks here in the audience, and Tana just showed up. She's from Prevention Management as well. She snuck in at some point. Or maybe I just missed you. I love tunnel vision. Sorry. All of these folks working hard to address this problem are having an impact. And I think we need to be really proud of them because they're the ones who are truly making a difference in our community. Any questions about that at all?
Any questions of the chief?
Your Honor.
Yes, Councilman Gard.
Chief, I noticed an improvement myself. I have a good friend and we debate this on a day-to-day basis. but I do see the improvement. And I do think that the effort that's put forth by the Volunteers of America and by the police have made a difference, and it is getting better. And so I would like to thank you and all these people that are here for their help, and I think it can be solved. It's not an easy task, and it will always have impact on the city of Riverton, but if we don't do anything, that's what we're going to get. Thank you.
I certainly support that comment. I agree. I think things are getting better, and due to the work of a lot of people that are spending time and making the effort to make it happen. So good job, Chief. We really appreciate it. It's nice to have that. I would also be remiss if I didn't say the last two presenters could be benefiting from some of the 2% beer money if we could have gotten that passed. But anyway, but no, come on, Wendell. You can afford it. Okay, thank you very much, Chief. That was a good presentation. Agenda item number 11, 1% committee. Now you can tell us, Wendell, about what it is that you're doing. Well, the Public Works Director wants to give his report first. Is that what?
Yes, Mr. Mayor, we've been working long and hard on trying to get some projects done and run into some weather problems and changes and things in oil. So we've had to make some changes what we're doing. And Kyle's got a presentation for you, and that we think this is the right way to go. And we've got some other ideas, and we'll be coming back with some more good.
Wonderful. We've got to get that money spent.
We're spending as fast as we can.
I know you are. I know you are.
Thank you, Wendell. Your Honor,
Kyle, please.
this addresses a proposed overlay for Pure Gas Road. A little bit of background. Federal requirements relating to the Americans with Disabilities Act, ADA, they've come down with some new regulations where cities, municipalities, counties, or whoever are updating roads are required to update ADA accesses, for example, ADA ramps, whenever road resurfacing projects are going on. This is to include overlays, not just full reconstructs of roads. So that's a little bit of background. The city has to comply to that. And of course, we want to make sure that our city walkways are as accessible as possible to persons with disabilities. So it's a good thing that we update that infrastructure. So all that said, the Force Committee, many of whom are here, and we appreciate their works, would like to complete an overlay project this fall. And they've asked staff to prepare a list of streets where these new federal requirements would not affect the cost of the project, i.e. streets without ADA access issues. On August 11th, 2014, Force asked staff to put together plans to widen and overlay Pure Gas Road. Right now, Pure Gas Road is 22 feet wide. We want to widen it a little bit and make it 24, just add a couple feet on each side. Staff had previously prepared plans and specifications to widen, for an overlay project, and is now working to adjust these plans to Pure Gas Road. Ms. Dawn Wilhelm has worked very diligently on preparing those and actually submitted those to me recently. So we're already moving forward on those. The Force Committee recommends City Council advertise for bid the Pure Gas Road overlay project once plans and specifications are complete. This project is estimated to be approximately $100,000. Currently, the 1 cent fund is estimated at $2,358,191.53. After subtracting the current commitments, the balance is $668,129.59. The city has been receiving an average of $150,000 per month in revenue. That being said, revenues in July and August were up over $200,000. Again, staff recommends the City Council accept the Force's recommendation to advertise for bid the Pure Gas overlay project.
Okay. Thank you, Mr. Butterfield. Chair would entertain a motion regarding the 1% committee recommendation.
Your Honor, I'd move to approve the Force Pure Gas overlay project as presented.
Second.
been moved and seconded. Is there discussion? Any comments? Okay. All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Mayor votes aye. Good job. I guess we don't need to hear any further comment from you, Wendell. Yeah. No, that's certainly needed. I was riding my motorcycle out there the other night, and you couldn't hardly stay on the road. I mean, it is in terrible shape. It really is. Yeah. Okay. Okay, agenda item number 12, Sanitation Task Force recommendation. Public Work Director report, please.
Thank you, Your Honor. The council, and I believe the community, is fairly up to date on this issue. To briefly go over the background again, Fremont County Solid Waste District has reduced their hours of operation at the Baylor facility and the Sandra landfill from 7 days a week to 5 days a week. This has affected the city in that we need to collect our solid waste and comply with those shortened days of operation where we distribute and drop off our solid waste collected through the city. Again, on May 20th, 2014, the City Council passed a motion to adjust residential sanitation pickup to 4 days a week. However, to properly address community concerns, the City Council reconsidered this motion on June 3rd, 2014, and voted against the 4-day residential schedule in order to further explore the city's option. During a work session held on August 12th, 2014, the City Council explored several service delivery options presented by the Sanitation Task Force and Public Works staff. A little bit of discussion. In light of those shortened days of operation, on July 1st, 2014, the city adjusted its commercial solid waste accounts to a 5-day Tuesday through Saturday pickup schedule in order to respond to Fremont County Solid Waste Disposal District's operational changes. Residential solid waste, however, those accounts still need to be adjusted to comply with these reduced hours of operation. As such, these accounts must be collected on either a shifted 5-day Tuesday through Saturday schedule or a shortened 4-day Tuesday through Friday schedule. The Sanitation Task Force recommends the city adjust its sanitation service delivery to an 8-hour shortened 4-day schedule. This schedule includes eliminating existing residential alley dumpsters and replacing them with roll-out receptacles. Residential alley collection of roll-out receptacles will be allowed except where utility and liability conflicts require curbside placement. A special assistant program may be explored to to assist elderly and disabled citizens who are not able to roll their rollouts to the curb or the alley. Furthermore, sanitation staff will supplement additional public works operations each Monday, since solid waste cannot be collected that day or delivered to the Baylor facility. Again, on August 12th, the City Council explored each service delivery option the Sanitation Task Force examined with city staff. These options, again, from what we just proposed, included an 8-hour shortened 4-day schedule, but they also included an 8-hour shifted 5-day schedule, a 10-hour shortened 4-day schedule, and privatization of sanitation services. The City Council also discussed replacing residential alley dumpsters with roll-out receptacles, except where the above-noted utility and liability conflicts existed in alleyways. To go over budget impact, again, it's tough to fully anticipate the budget impacts at this time. However, we do know that from the task force recommendation to go to rollouts, there will be a one-time capital investment of approximately $75,000 to $100,000 to purchase rollout receptacles that would replace the alley dumpsters, residential alley dumpsters. The city is currently budgeted I'm getting my words mixed up. I'll slow down. The city has currently budgeted $80,000 for this capital investment. The city has an existing inventory of approximately 245-gallon rollout receptacles, which are ready to be put into service upon demand. The capital investment and rollout inventory will be dictated by how many existing 45-gallon rollouts will be put into service. A rate resolution specifically addressing 45-gallon receptacles will be explored by staff and presented to City Council in the future. A couple other notes. The county has worked with the city as we've looked to address this imposed shortened days of operation where we can collect and drop off our sanitation solid waste. That's a 6-month grace period they've given us. We're already a month and a half into that 6-month grace period. It started July 1st and it will end January 1st, 2015. A couple notes. Should the council vote to approve the sanitation task force recommendation, we will need to solicit bids relating to the purchase of these rollout receptacles. We currently have solicited a bid from one company, but in order to maintain proper transparency and protection of public funds, we want to solicit more bids than one so we protect the integrity of the city's funds. That would probably be about a month to do that. And as it stands right now, it's expected the lead time from order to delivery of these receptacles at best would be 6 weeks. So you're looking at a month and a half at best once they're ordered to get them basically into the city. I mean, if we think it takes about 2 months to average it out just for the ordering process, once we solicit bids and then we purchase or make the order to purchase, we're expecting about a 3-month process. From today, that 3 months is November 19th. And we would like to get this implemented, obviously depending on how the council directs us, as soon as possible. In the end of the year, there are many holidays. Around holiday times, people tend to increase their solid waste. And so I think to ease that transition for our residents, it would be wise for us to implement this as soon as possible to assist them. Those are the notes I have. I'm obviously available for any questions if you have any further questions you'd like to direct towards me.
Okay. Thank you, Mr. Butterfield.
Thank you.
The chair would entertain a motion regarding the sanitation task force recommendation.
Your Honor, I would like to make the motion that we accept the sanitation task force recommendation without the special assistance program.
Second.
Did I hear a second?
Yes, second.
Okay, it's been moved and seconded to accept the recommendation of the task force without the assistance for the elderly. Is that my understanding?
Yes.
Okay. Is there discussion?
Your Honor.
Yes, Councilman Smith.
Yeah, last week I was accused of being a little bit quiet, so I took some notes. Thought I'd make up for that just a little bit tonight.
Good.
Addressing some of the issues that we've discussed in the last couple of months. It's the same motion that we had actually before us on May 20th when we had that meeting. We need to, as we look at monetary issues, as we look at spending and costs, I think we need to keep in mind of what we were told last week, that if we keep the dumpsters, we're going to have to replace a lot of them. We're going to have to spend some money either way. And so regardless of what the county's doing with their waste pickup, we're going to have to spend some money. It's easy to forget over the course of a couple of months what we were told back in May, but I did write down, there was a quote in some of the material in our packet in May. It said, we would be able to budget for 2 part-time seasonal employees instead of 2 full-time employees in the streets department, saving approximately $68,608.44 in the general fund. That was presented to us as an offset for some of these new rollouts. So the money's going to be there either way. We're going to have to spend some money. Money has been budgeted for that. Also, I think we've been presented now twice with recommendations by staff and now with the task force who looked into all the options, that this is going to be a much more efficient way for us to do our sanitation pickups. Some of the concerns that have been brought up, there are concerns with some of our elderly citizens that may not be able to roll their rollouts out. But we also have to remember the other numbers as well. We have 2,086 accounts that are already on rollouts versus adding another 1,545. This is a great opportunity for our community to practice a good neighbor policy. There's been many times that I have rolled my neighbor's rollout out when they've been gone, or rolled it back to their house, and they've done the same for me. And we need to take care of each other, and I think that's just an opportunity for us to do that. We need to take care of the elderly, and there's probably a lot of elderly in those existing 2,086 rollouts already. So I don't think that's a legitimate issue. We should also be taking care, if we have an elderly neighbor, when the snow flies, we ought to sweep their walk or shovel their walk as well. So I think we need to kind of step it up as citizens and take care of each other a little bit, and this is an opportunity to do that. Another issue that was brought up were the looks of the rollouts, that if we go from putting the dumpsters in the alleys to putting rollouts on the street, that would trash up the community or make the community look bad. Well, that seems a little arrogant to say that 2,086 of us who already have rollouts have trashy looking communities or neighborhoods the day that the garbage goes out. It's just a fact of life. Once a week we get our garbage picked up, and I don't think that, I mean, that's a minor inconvenience, so I don't think looks are a big issue. I don't think the rest of the town looks ugly when those rollouts are out. It's just something that needs to be done. Also, with the congestion, it was brought up some of our streets are narrow, and we've got a lot of parked cars. We talked about 16th Street. This last week, I was looking in my neighborhood on Elk and Moose, and you wouldn't have believed the number of parked cars that were out there with rollouts when the trash was being picked up. I stood there on Monday morning as they were picking up the yard waste and watched one of our sanitation people squeeze in between cars and pick up these yard waste bins without any problem, and it was a highly congested time on our street. So our sanitation workers know how to work around congestion on the street. I don't think that's an issue. And one final thing, we had talked last week in our work session about the possibility of outsourcing, and I think just so we have the facts and figures before us, that should be an opportunity that we look into in the future. I think right now it's a good move to go to the rollouts, but possibly in the future we need to look at maybe outsourcing. I did live in Lander from 2000 to 2007. The level of service was virtually no difference. I can't say that we have better service or worse service than Wyoming Waste or Waste Management. And we talked a little bit about pricing. A lot of things that we talk about in our budget is how much we spend a month to dump our trash. That's a big issue. It's getting worse with all of the mandates. We've got a lot of overhead. We've got a lot of burden with those kind of issues. If someone else was handling it, we wouldn't be dealing with that every finance meeting, talking about some of those issues with trash costs. I also did a cost comparison myself. We were told that our trash cost was a lot cheaper than what Lander has. I called a friend of mine. He told me he pays $95 for 3 months for trash pickup in Lander. Our rates right now for a 90-gallon container is $31.92 a month, which means without recycling, we pay 76 cents more in a 3-month period than they do in Lander for trash pickup. Now, I'm on the recycling thing, so I save a couple bucks a month. My savings is a difference of $4.94 with recycling over what Lander pays for their trash pickup right now. So I think we need to keep some of those options open for the future as we discuss things, because trash and how we dispose of it's not going to go away. It's going to continue to be a problem as there's more federal issues and things that come up with sanitation. Thank you.
Okay. Thank you. You've been saving up, I can tell.
Your Honor.
That was a very, very good commentary. Yes, Councilman Dowd.
Point of interest, are we going to have open hearing on this from the floor?
Yes, yeah, as soon as the council gets done
We get to go
commentary to
first?
start with. I'm sorry?
We get to go first?
Yes.
Your Honor, my heartburn comes from a whole other side. And I've been watching the emails, and Councilman Canan has been doing a wonderful job researching that, and I feel like I'm in the minority tonight. I'm used to that spot, so it doesn't scare me. But I think for a change, it seems like we get all of these mandates passed down to us from government entities, and we never push back. We just assume that that's the only way it's going to be. And for a change, we are the big check in the pool. And I really think we need to revisit the solid waste division and come to a better agreement than them just mandating to us what we are and aren't going to do. And that comes from how quickly our trucks go through the turnstile down at the Baylor's position. And I know this is reaching way out there, but maybe we have to do like PAL and find another organization that's willing to pick up our trash for us. And so I think we need to go and discuss that point blank and not just take the mandate that we will do what we're told to do. Thank you.
Thank you, Councilman Guard. Is there any other councilman that wants to make comment right now?
Your Honor.
Councilman Canan?
Sir, I'll tack on to what Councilman Smith was saying is that, again, I think this decision affects all of Riverton, not just the individuals that are in the process of switching from dumpsters to rollouts. One thing I'll add to Councilman Smith's comments is that when you go out and talk to the people that already have rollouts and you present this idea to them, granted, they're not concerned about switching from a dumpster to a rollout, but when you talk to them about the options of turning those extra sanitation workers loose for an extra day to, quote, pull weeds, paint, chip paint, throw gravel in a pothole, those individuals really, again, like that idea to think that, once again, they can see some improvement in the city getting cleaned up, other projects being done because of that extra manpower. So, again, I think it does affect those other, would you say, 2,000 and some odd individuals that have existing rollouts. They like that idea.
Okay, thank you.
Your Honor.
Yes, Councilman Fabian.
I definitely can understand Councilman Guard's point that there's a time to push back, and I agree that we get handed down things from various entities, but I guess I just don't feel like this is that time. They came to us not to try to bulldog us or do anything like that, but because they looked at their budget and said, if we do these things, we can probably keep our sanitation rates at least where they're at, which is incredibly high, but at least they're not going up. And they came back to us and said, if you guys can make this work, then you'll save a little money, or at least things aren't going up. And so here we are with a great idea that we can meet that. And I guess I just feel like, in the interest of protecting the public's funds, that's what we've got to do. So I guess I fall with Councilman Smith. Thank you.
Any other comments? Anyone from the audience like to comment on this issue?
I guess I'm talking to you a lot lately. Mr. Smith, what area of town do you live in?
I live on Sunset and Moose.
Yes, Sunset and Moose. A good neighborhood. And you use rollouts?
Yes.
Does garbage fly all over when they tip over?
Sometimes.
And who picks up the garbage?
I do, or I help my neighbors when theirs goes over.
Oh, yes.
Yep.
Well, I'll tell you. On 16th Street, there's a slope that goes down like this. I can barely get 2-gallon containers down per recycle. In the wintertime, a rollout would be impossible for me without falling and breaking my neck. That is inconvenient, number one. Number two, at the last meeting I was at, the figures that the young lady presented was not accurate. I timed your garbage truck today that went in the alley. On the average, it took 1 minute to dump a dumpster. We followed it. There was 4 dumpsters in each alley. Within less than an hour, it had serviced over 125 houses. Now, my question to you, she told us that it took an hour that they could pick up 100 of those containers. I don't see how they can pick up 100 of that containers when they have to go up and down each side of the street in between vehicles to get garbage. Now, the other thing is, those garbage containers, the wind blows them, they fall down, they get slammed down, they crack, and they break. And the garbage goes all over. This is ridiculous. You need to keep them alley trash containers where they're at for those that have them. Otherwise, put the rollouts in the alley, which the alley was built for. The front of the streets was not built for garbage disposal. That's what the alley's for. That's why you have an easement. And as far as saving money, I can't see how you can save money. You can take those steel trash containers and you can repair them. But you can't those plastic ones. You have to toss them. Then they go to the recycle again. And the other thing I learned, that Riverton is hauling its trash to the Lander landfill. That's 26 miles one way. What happened to our own disposal landfill? Why are not we using that to save on time and money? Now, you young folks, you're pretty young, but you're pretty hefty too. I'm not. And there's a lot of us that aren't. And you're young. In my younger day, yeah, I could do it, but I can't do it now. Now, I am upset with all of you, and he's a new one on the field. I think you were sitting in on the meeting the last time I was here. Better keep ours where they are. Your fancy rollouts ain't going to save you money, and it isn't going to save you time. And it is not efficient. That little old gal went through that alley, and it took no longer than a minute to pick up the trash can, dump it, put it back down, and go to the next one. Now, pardon me, but I can't see pick it up 100 containers makes it more efficient in an hour's time when you can pick up 125 homes in less than an hour. Now, I'm not happy about way some of you're spending our money on stuff that is not necessity. There's a lot of that fancy stuff we can very well live without. The necessities you're letting go by the wayside time after time. I could care less about a recreation board or all the fancy facilities. And the parks are all fancy, good, and fine. But how many white families do you see down in that city park using it for what it was originally meant to be? Not many. You couldn't go there and sit in the daytime and not be bothered. It's time we started doing things that take care of our basic essentials. Instead of fancy skateboards, hockey rings, all that good stuff. And all these fancy programs. And I'm sorry, but if you looked at the occupancy at the Alcohol Crisis Center, how many white people are there? There's a little discrimination going on. But if there are people's there, it's fine. But then the tribe should fork over some money to help pay for it. And yes, I'm objected to your putting those rollouts in my alley. But I'd take them in my alley before I'd take them out front. Unless you want to come every week and roll mine out for me and roll it back. Would you like to do that?
I'd be more than happy to find one of your neighbors who would do that for you.
Well, let me tell you about my neighbors. My neighbors are all old. Most of them. They're just like I am. You're gonna reach my age someday. And you're gonna find the inconvenience it causes. Now, we try to keep our streets decent looking, but it's then let go in that area. And no, we don't live up in the prime side of town, where it's easy to roll them out right out of your garage. All those houses don't have garages attached to the house. There's no entryway into it, except from behind. I think you better take a drive around the city a little bit and look to where those containers are, and the alleys are big, nice, wide alleys. The weeds just need cut down in them. And if you insist on them roll-out containers, have them where we can put them in the alley. It's level. Okay? That's mine.
Thank you very much, Judy. We appreciate it. Anyone else like to address the council?
Your Honor.
Let's have the public. Then we'll...
I'm Rachel Phillips. I'm not going to beat a dead horse, but I love your idea of, being neighborly, and that's great, but realistically, I mean, I try and help my neighbors, but not everyone's going to do that. I'm a lot younger than probably all of you in this room. And I have a hard time with my parents' dumpster. They live outside of Denver. And not dumpster, bin. But they have the roll-out bins. And it's lovely. They clean up the trash and everything. It's nice. But they're huge. And you fill them with trash, and they're awkward. Really awkward. And even though I'm spry, young, I have a hard time rolling them out for my parents. And if we're going to have the rollout dumpsters, we need some assistance for these people, because if I have a hard time, they're not going to be able to get their trash out, and we're going to have a bigger problem on our hands with senior citizens living in terrible conditions because they can't get the trash out. And sorry, but also in probably our side of the neighborhood, we don't have access to the curbside. My house, I have a set of stairs I have to get down to get my bins to the curbside. It would be so much easier if we could get into the alleyways, because otherwise I'm going to be leaving my bin out there because I can't be bringing it up and down the stairs every week. That's going to hurt my back eventually. So I guess that's my 2 cents.
Okay.
Thank you.
Thank you very much. Good evening, Betty.
Honorable Mayor and City Council, I'm Betty Malicki. I think most of you know me. I usually come to be a rabble-rouser. I live at North 14th. It's a 2-block dead end. Tonight, as I was coming to council, I drove down. There are 4 mobile homes, one with a pop-out, and a boat parked in those 2 blocks. Tonight, there were only 6 cars, but that's because everybody's gone except us. Normally, there's 12. Now, will you call me when that garbage truck picking up those rollouts maneuvers in that mess? Mr. Broadhead, I think you better be prepared to get some things moved down in that area. And there are only 4 homes on this side of the street, and I believe 8 on the other. The rest is a vacant lot. Okay, fine. Obviously, rollouts have already been decided upon long ago before this discussion started, and it perhaps is the way of the future. I dispute Mr. Smith's statement about the elderly. The elderly in this town basically live in areas that have alleys. That's the east end of the east. Some of it out to the north and to the south. Those are your elderly communities. As a gentleman said to me today at the polls, We've been here 50 years and you've never touched our street. He lives on 16th. And that's true. But these are where perhaps the majority of the elderly people who have been in Riverton, citizens for a long time. Your expenditures, I believe they're a wash. You're either going to buy rollouts or you're going to replace some of the bins. What's the difference? Money is money. $80,000 is $80,000, whatever you buy. I like your suggestion about further exploring privatizing. And some of the objection has been cost. Well, obviously there isn't a whole lot of cost. Tree limbs, recycling, that isn't done by your regular rock garbage program right now. It's a separate program, so that has no bearing on the fact. The desire to not discharge an employee, that's very grand. I don't think that would ever happen because every entity has a turnover in employees. And certainly, in my humble opinion, the city street department could use an extra hand or two. And I commend you people for the work that you have done. You don't have an easy task by any means. I've done it. But is there any possibility that you could look at a dual program? You're going to have to run the trucks for the commercial. In back of me, I have 3 commercial dumpsters and 2 home dumpsters. If they're going in there for the commercials, why not pick up the others? I don't really have a strong objection to the rollouts. I think they're the pits. But as I said, I think it is the future and what's coming. And the trash pickup is becoming a more critical issue. Thank you.
Thank you, Betty. Anyone else? Mr. McDonald.
I'm Mike McDonald, as most of you know. I'm getting to the age where I have back problems, so I'm gonna lean. Couple of things. I was on the Fremont County Solid Waste Board from 2003 to I think the end of 2011. We hired a new superintendent at that time, and we gave him direction to save us money. We were wasting a tremendous amount of money on our rural transfer stations. We were collecting on a weekly basis. Sometimes we had a load, sometimes we didn't. And anyway, through the last couple of years, in my view, they've kind of straightened that out. They have certain hours at the transfer stations, sometimes only a couple times a month. And something that you probably need to think about is we have to cap those landfills eventually when their economic life runs out. Now, Lander, we made a deal with the DEQ, I can't remember, I'm guessing 2004 or 5, that we would close that in the year 2023. The reason that the Solid Waste District is hauling garbage from the Riverton bale stations to the Lander landfill is that they want to crowd as much waste, solid waste, or municipal solid waste into that landfill, which in turn will extend the life of the Sandra landfill when Lander hauls all their garbage over to Sandra. So that's the reason for that, and it's to me it makes sense. It was always my contention that we paid for the caps as we went, and we hadn't been doing that. We had no reserve account. 1 year we had to borrow money from the county because quite frankly, our management was that poor. But that's all changed. I estimate it's going to cost in 2023 somewhere between $6 and $10 million to cap that Lander landfill. And then you have to monitor the darn thing forever, or approximately forever, so there's additional cost there. Maybe that'll help your thinking, and maybe it won't. And speaking of Mr. Smith, you live in the game preserve, as I call it. I used to live up there too, and you don't have any alleys up there. So you have to put them out at the curb. One thing I haven't heard being considered, and I assume it probably has, is Riverton is an aging population. More and more of our people are becoming senior citizens, and I think that should be in the back of your mind, and think about that. I myself, as you can see, I'm getting hobbled up, and I don't have a rollout, quite honestly. I live in the county, but anyway, I wish you'd kind of keep that in consideration. I think if you can put your rollouts in the alley, perhaps you should do so. So anyway, thanks for your time.
Thank you, Mike. Anyone else want to address the council at this time? Identify yourself for the record, please.
Hello, my name's Terry Hayes. I live at 906 East Roosevelt Avenue here in Riverton. I guess my main concern is that with these rollouts, what is the purpose of trying to save money when it's going to cost more to buy them? I was sitting at home watching the discussion, and I think that ultimately it is a waste of money because you've already paid for all these dumpsters and you have the transportation to utilize to use these dumpsters, and I find it hard to believe that it would make more sense to go to just rollout dumpsters than just going with what we already have in place. I mean, this has been the same style we've used for how many years? I've been a resident here for 32 years. I was born and raised here, and I've never seen where we need to transform and go to something new just because someone thinks it's a better idea. Unless it's studied and tried, I think that ultimately I would stick with what's already tried and true and has worked for these countless years. And I think that with trying to save money, you know, and utilize employees to do other things, and this would be a simpler, faster way of cleaning up the trash, I think it would be smarter to hire somebody else to, you know, clean up weeds or help paint or, you know, chip paint or do something than do that. I mean, there's plenty of other projects that I think the money could be spent on, and the projects that we are spending the money on, I think ultimately it's just, it doesn't make sense to change what's already a good practice. As some of the comments were said earlier tonight, I think ultimately it's going to be a challenge for the elderly, and not everyone in Fremont County is so neighbor friendly. I have neighbors that I haven't even talked to. They never come out of their house, or they're never even home. So if there's an elderly resident that's nearby, how are they going to get their trash out if that's the hopeful practice of how this new program is going to work? I mean, I don't have a problem going and sweeping my neighbor's driveway, or, you know, trimming weeds in front of their house, or, you know, going over and do something that's needed. But I mean, you can't do that for as many people live in this town. You can't be a superhero and go around to do everybody's yard and do their trash receptacles. It's much easier going through the alley, and I think that is going to be a problem. You're going to waste more time and have more traffic delays and stuff having these new trucks sit out in front of the cars that park out in front of their house that don't have a garage, when there's an open available alley where you can take these dumpsters and put them. And it is easier to go through your alley than have these trash cans sitting out front. You know, another concern I have is the flies and stuff. You know, there's dumpsters that are, the one dumpster is parked right behind my house in my alley, and people put dog poop and everything else in it, and there's flies there. I'd rather the flies be in the alley where no one sees them instead of right out in front of my house when someone comes to greet me. So I guess that's my concern.
Okay.
Thank you.
Thank you very much. Anyone else in the audience want to comment? Okay, any other, I think you had a comment, Councilman Larson?
Yes, Judy's neighbor came and visited me, and he is mad as heck because he does not see that it's going to improve anything. Where Judy lives is on a hill with no access to the front, and the practice of parking their vehicles in front of their house makes it, if they could roll them out, they couldn't put them there because the cars are parked there. But the back part is the design, the whole design of that area is a design that has an alleyway which is accessible to storage of garbage. I've got a property on Spruce that has a alleyway. I have a property on 2nd Street, 2nd North, that has an alleyway. And those are conveniences that these people and that I have grown to appreciate. And the trash problem has caused us more difficulty than the budget or anything else. And it seems to me that we need to explore, one, privatization, two, that we need to find a new source. And I really appreciate that Mike made a good agreement with the DEQ on the capping of Lander, but I really don't give a damn about Lander. I live in Riverton, and I pay taxes in Riverton, and I am for Riverton. So extending the space in Lander to 2014 or 2024 or whatever, I would rather ship it to somewhere else, because right now on the finance committee, we're getting hosed by our people that are at our best will. I'm certainly going to vote no. Thank you, Your Honor.
Thank you.
Your Honor.
Yes, Councilman Christensen.
Just a few points. Mike McDonald clarified the issue with the Lander landfill. It is our trash that does get over there, but it goes to the baler first. So it is Riverton trash that goes to Lander. And they're trying to expedite the filling of that, which is going to be a money saver in the long run. That's a county problem. That's, I consider, all of our problem. The issue of, well, let me address this first. I just spoke to Andy Fry this evening, just before I came. He returned my call. The issue of privatization. Currently in Lander, they do have a private hauler, and 90% of the people in Lander take their own trash to the landfill. Is what he told me tonight. 90%. He said it's huge. He said it's huge. Most people do that. So I have to believe what he said. He said, but that is the main, folks in Lander choose not to use the private carrier at this time, or some of them don't. So that's something to consider. I was kind of surprised at that number. The rollouts in the alley, I just want everybody to know that there are a lot of areas in town, and there is a map available that those rollouts will be in the alley, in the same place. I don't want people to think that they're all going to the streets. A lot of areas will. I don't have that available to me right now, but I wanted people to be reassured that some of them are staying in the alley. If you get a rollout, it'll be there in the same spot. Maybe there'll be one side or the other, so it's easier to pick up. In the issue of congestion on the streets for the workers to pick these up, I have ridden with these guys, and honestly, I was amazed at what these men do and women do. We picked up over in the Riverview Terrace. Oh, I won't say any more. It's congested. Very, very congested. These guys and gals are just talented. They swoop in there in some pretty amazing sights. They're bumper to bumper, trailer to trailer, whatever's out on the street. So they are very good at what they do. But some of those issues, I think, can be alleviated about the, I don't know about your address. I think, I don't know if you can answer that, Kyle, what that area.
Your Honor, I do
go
have
to?
the map before me. I'd be happy to look up your address. To answer your question, the majority of the pickup will remain in the alleys. There are just a few areas where we have, again, liabilities from property damage or from overhanging power lines, trees, etc., tight corners. We also have issues where there are alleys in some of our city that actually are not legally platted alleys, where I think that could pose a problem in the future if we're accessing those alleys where we're not really having a legal right to be on it. So again, the majority that are switching from the alleys to the alley dumpsters to the rollouts will remain in alley pickup. There is a small percentage of the area that will have to go to curbside.
Thank you.
And you specifically state which areas will the rollout stay in the alley?
Your Honor, I'd be happy to look that up and even prepare a list. I have a service map before me right now. It may be difficult to go street by street right now, but I'd be happy to compile that list, Your Honor, and make that ready.
I think those are the kind of things that if we do choose to go this direction, that will have to be made available to the public in a large format so that everybody can find their home and know how it's going to affect them. But
Your Honor?
yes.
I do want to say that we did have a large presentation down in the city hall parking lot for, I can't remember the date, where we did have that map, and then the map was available in City Hall so people could go and look and see where that option might be.
I was slapped down.
You're,
I had been ill.
oh,
Got out of surgery again last week.
sure.
So,
Your Honor.
had the opportunity.
Thank you.
Thank you. Any other comments?
Your Honor.
Yes, Councilman Fabian.
Just a couple of other things to answer Mr. Hayes's concern about the cost. We're going to have to replace some dumpsters, whether they're with rollouts or metal ones. There are a lot of dumpsters that are at the end of their usable life at this point, and will have to be replaced. And the other thing I wanted to say is that the biggest portion of the time saving with the rollouts comes more because of the nature of the truck than it does because of the time it takes to dump. Part of that 3-minute time that they were quoting is because that truck has to go to the baler at least 3 times during a day. The new truck only has to go once, and that makes up a lot of time. So, thank you.
Thank you. Yes,
Just one more
Councilman
comment
Christensen.
that I found kind of interesting in the last few weeks is a friend of mine happens to be a truck driver, and I ride along with him. And there is a company in Warland that specifically hauls dumpsters. This business is so lucrative that the purchase of and moving around of dumpsters is, I talked to 2 of the truck drivers, and it's Warland Dumpster Hauling, I can't remember what it's called, but they move them all over. So the same process is going on in different areas. They go all over the West. But these gentlemen I talked to the other day, Sunday in Thermopolis, he was going up to Billings, that area, and he was selling that whole load up there. I didn't ask any more specifics, but there is a market for dumpsters that we would not be using or possibly would. So, thank you.
Thank you.
Your Honor,
Yes, Councilman Garden.
how many dumpsters have we purchased since you've been with us, Mr. Weaver?
Your Honor,
The large dumpsters.
I couldn't give you that number.
Is it a large number?
I think we have money budgeted every year to replace some of those. It's not a I mass purchase. We get some and replace them as they go, but I I don't know if it's a large number or not. In looking at the product we have around town, I would guess not, just because I've been down the alleys and a lot of the dumpsters are pretty tore up.
Yeah, I've had the same dumpsters for 15 years. So,
Okay.
thank you.
Okay, before I call for the question on the vote, I had written a short epistle to the council regarding my feelings on the issue, and I'd like to read that into the record at this time. I don't think it'll be quite as long as Councilman Smith's, but I'll try to be brief here. I have to ask myself why we want to make the level of changes necessary to force all of our citizens to go on rollouts. Our mission statement is to instill public confidence through exceptional customer service in a transparent, professional manner. We do have to make some changes in the way that we do business with the county, making changes in their hours of operation. We all understand that. But why does it require the abandoning of a system that is liked and successful with a large part of the population? I've heard more pushback on this issue than on any other issue that we have dealt with in my last 3.5 years. I would recommend that we move forward with the option that will provide the least disruption of our existing system of pickup. This is also the strong desire of the citizens that are being affected. Is it truly because of efficiency that we are considering this change? I have never heard that government at any level is particularly efficient. We accept as a fundamental principle that providing the exceptional customer service in our mission statement should not be provided in opposition to the public's feelings unless the need is very grave. This is the same type of argument that got us spending over $1 million in bailers and is now telling us a few years later that we should not have gone that way. It is the same thinking that got us into the SLRP Sirline replacement program that cost the city several hundreds of thousands of dollars before we got out of that. The intent of both of these projects was well-intentioned by good people, as is our current rollout issue. We do not want to stifle the desire of the staff to be more efficient, but we also need to remember who is paying the bill and who our boss is ultimately, the citizens. In the areas of the city where there are no alleys, we are only left with a rollout option, and all of the citizens in those areas understand that. In the older parts of the city, we should see dumpsters as assets in helping to keep our community clean, which is a problem that will be exacerbated by doing away with them. Dividing up the garbage from one large dumpster into several small rollouts is going to increase significantly the mess overall. It may be more efficient and the customers will be able to be held more accountable for their garbage, but it will cause for a much dirtier look in our community. This along with the fact that the affected citizens don't want it. If we could do away with dumpsters across the city and not have any dumpsters, then a sound argument could be made to go to all rollouts and only have trucks that can pick up rollouts. As long as we are required to have both rollout and dumpster pickup, that argument goes away. It then becomes an argument that one is more efficient for our staff and may cost us a little more to do. The public is paying for it, and at this time, with over $1 million in cash reserves, according to Kyle, and the public outcry, I cannot understand our push in this area. The public is not complaining, to me anyway, that garbage collection is costing too much or that they are dissatisfied that we should be more efficient. This efficiency argument is all coming from the city staff. To me, this seems to be in conflict with our mission statement regarding our obligation to provide exceptional customer service on this issue. If we are truly intent on being the most efficient with our budget, we should get out of the garbage collection business entirely and turn it over to waste management and the public to solve this problem. We would lose about 6 employees, all of the expenses of the existing containers, the trucks, as well as the fuel and maintenance for them. This would be a huge savings to our budget. It also would be like cutting off our right arm. While the city does not have a legal obligation to keep this service, I feel we do have a moral obligation to maintain those services that we have invested in with our citizens' money over the years, as well as keeping the many jobs that would be lost. Let's not lose sight of our obligation to our citizens and their need in pursuit of some higher score number on an efficiency scale. If we start cutting programs because of lack of efficiency, I think that there would be many of us gone. Let's all work to be more efficient, as this is a very commendable goal. But also, let's remember who it is that we work for and that we are trying to instill public confidence, not public unrest, which we are currently in the process of doing. That was my commentary to the council regarding this issue. I received a call today from one of our citizens. She and two of her friends had written a letter, and they said they weren't going to be able to be here this evening, and asked that I read their letter into the record. But in lieu of their record, which we've letter which we've already seen, I decided to read this one. So at any rate, it's a difficult decision that we're making. When Mr. McDonald was giving his presentation and made the comment about his being all stoved up and whatnot, I remember working on road construction with Mike. He was the safety officer for Gilpatrick Construction, and I was one of their laborers and laydown foreman and whatnot. But we're all elderly, or are going to be elderly, and I feel that more and more every. No, Wendell's shaking his head. No one thought you would have ever lived this long, Wendell. But at any rate, it's a difficult area, and I understand where you have no alleys, you have no options, okay? But in the areas that we do have alleys, we do have options. So if we do choose to go with rollouts, then for goodness sakes, let's do everything we can to take advantage of our alleys and be sensitive to the needs of our aging citizens. I just hope that we go the right way on this one, and it's one that's going to have a serious and significant impact to our community for a long time in the future. So, but I'm sharing Councilman Larson's feeling. I'm going to have to vote against it and see where it goes. So at this time, we have a motion and a second on the floor regarding the sanitation task force recommendation. Could you reread that, if you would?
Yes, Your Honor. It was moved by Councilman Smith to accept the task force recommendation without an assistance program, and seconded by Councilmember Fabian.
Okay. We'll go ahead and have the vote on that motion at this time. All those in favor signify by saying aye.
Aye.
Opposed?
Aye. Opposed.
Aye. Let's have a roll call vote so we all know where we are. Do you want to go ahead and have the...
Yes, Your Honor. Councilman Richgard.
No.
Councilman Martin Canan.
Yes.
Councilwoman Mary Ellen Christensen.
Yes.
Councilmember Jonathan Fabian.
Yes.
Councilmember Kyle Larson.
No.
Councilmember Todd Smith.
Yes.
Mayor Ron Warpness.
Votes no. Okay, so it passes 4-3 split. Okay. Agenda item number 13, Wyoming Community Gas Distribution. Public Work Director's report, please.
Thank you, Your Honor. Each summer, Wyoming Community Gas distributes some of their earnings to member communities. As such, the City of Riverton has been asked to designate a community-related project wherein this distribution may be used. Wyoming Community Gas plans in the future to film a commercial highlighting the local improvements made possible through their distributions. This year, they expect to distribute $6,374.93 towards the City of Riverton. City staff proposes that the Wyoming Community Gas distribution be used towards the purchase of new playground equipment at 2 of the city's parks. These parks are Monroe Park and Teeter Park. At Monroe Park, we are proposing a new swing set be installed to replace the existing. The existing has some old weld joints and has aged quite substantially. This new swing set will be 2 belt swings and 2 tot swings, totaling $1,985. At Teeter Park, we're proposing to eliminate an existing S climber. That's the best way I can describe it. It looks like an S, and kids can climb on it. Staff is proposing to replace that piece of equipment because it is old and is not frequently used. So we'll replace that, and in its current location, we will install 3 playground equipment. The first of which is a wave walker for $1,256, a tarantula climber for $2,514, and a saddle seat spinner for $513. In the council packet, there are pictures of those items. There will be no budget impact. The proposed park equipment totals $6,268, and again, the grant appropriation is $6,374.93. We had the opportunity to contact Craig Blumenshine, who is a citizen on a committee regarding our parks and trails, and he was definitely in favor of the opportunity to replace and upgrade some of our park equipment with some other, he was a great help and provided many suggestions to us, so.
Okay, good, thank you. I was glad you were able to get hold of Craig and get their input on it as well. Okay, the chair would entertain a motion regarding the Wyoming Community Gas Distribution.
Your Honor, I'd move to approve the Wyoming Community Gas Distribution recommendation.
Second.
Been moved and seconded. Is there discussion?
Your Honor,
Yes, Councilman Fabian.
I just simply would like to point out that based on the audit that's been being done of usage of city parks, Teeter Park is actually our most highly used park, which I think is very appropriate to give that much into that park.
Weight it a little more. Good. Okay, any other comments?
Your Honor, I just want to make one comment. We're required to put some sort of plaque on each of these park equipment showing that it was donated by Wyoming Community Gas. And so the rest of the money that we have budgeted there will be used for little plaques to be put on those parks equipment.
I figured that would be for shipping. Okay, yeah, there wasn't enough left over to worry about, so. It was okay, we have a motion and a second on the floor. All those in favor signify by saying aye.
Aye.
Opposed, same sign. Mayor votes aye. Okay, reports and comments. Council committee reports and council members roundtable. Councilman Smith, would you lead off?
Sure.
I would like to thank Chamber of Commerce Director Jim Davis for showing up tonight and giving us the tourism asset dollar funding request. I forgot about the meeting last month and didn't make it, so Jim came down and bailed me out and gave a nice report on how that funding is being spent, so I appreciate that. And the only other thing, at the risk of coming across as a little sarcastic, we had a great presentation by the EMS services that the Affordable Care Act is not going to be very affordable when it comes to health care at all, so.
Surprise, surprise. Councilman Larson.
Your Honor, I spent last week in Yellowstone Park, and I was amazed at the number of people there, and I couldn't remember them coming through Riverton, and I'm trying to figure out how to get them through Riverton so we could empty some of their pockets. My only comment.
Kyle, just a side note on that, there are quite a few that come through. We haven't come through the chamber all the time. Not as many as in the park.
1,350,000.
Let's address the chair, gentlemen.
Yes, thank you.
Thank you. Councilman Fabian.
Your Honor, the trail committee had their bike ride last night to look at the trails through Riverton. I unfortunately was not able to make it due to illness, but I anticipate a report from that to be coming forth very soon. And I think that's all I have tonight. Thank you.
Okay, thank you. Councilman Christensen.
Your Honor, no committee reports, but I do want to say something about someone in the audience that I think this is the Rachel I met with, and yeah, we've only met once. But I would like to, I don't remember your last name, I do apologize. Phillips. I do want to recognize her as the organizer of the Fremont County Fair Parade this year. She did a great job, stepped in at the last minute, her and her organization, the JCs, and pulled off a great parade. So I think, I hope they do it every year, and I'm getting too old. Yeah, but she did a wonderful job. At the last minute, it was a wonderful parade, so thank you very much.
Thank you. Councilman Canan.
Sir, also, I don't have a committee report, but I would definitely like to make the suggestion that we take the information that Chief Broadhead put out tonight and definitely, I'm not sure what type of a form to put that into, but something that we could put out over County 10 or in the Ranger. I mean, again, you talk about good news. I definitely think that is good news that needs to get out to all of Riverton. I realize we have an audience that listens to us every meeting, but probably not anywhere near as large that goes on County 10 or Reach the Ranger. And I definitely think that's the type of information that needs to get out to the public.
It's interesting that we don't have any news here this evening, so I don't know what was going on there.
Your Honor, I can give an update on that. Ernie is doing elections.
I think you're at the election, yes.
And then Alejandra is on maternity leave, and so the person covering the city is actually located in Idaho Falls, and she watches them the day after and reports.
Yes. Okay. Councilman Gard.
Thank you, Your Honor. There was an airport task force meeting on the 14th up in Du Bois and at the headwaters, and it was 3 hours long. It was a good meeting. There's a lot of work going forward trying to take care of that problem. They had a meeting for the press prior to the meeting, and then we tried to hammer out some things there. And so I think there's some good movement on the airport. Thank you.
That's good news. Okay, City Administrator's report, please.
Yes, Your Honor. I want to give an update on our Business Council grant that we submitted for the Honor Farm property. Staff has now recommended approval for that, so that's good news. I'd like to thank everybody that's participated in that. We've had legislators and members of IDEA that have worked really hard on that. That will be going in front of the August 28th meeting up in Powell, and so I'll be attending that, and hopefully that it will go through and we'll be able to keep moving forward. The next step in that process will be going through a SLIB and the state lands approval. That's probably going to be the harder of the two, of getting them to approve that land to go up on auction, and then it would go to proceed to auction. The other thing is, I wanted to know if the council wanted to participate in the Empty Bowl event that the Center of Hope is putting on. You sponsor a table, or so we haven't had a formal request to the city, but I thought that may be something we might want to do. I know individuals are doing it, and people may say that the city's already sponsoring the Center of Hope at a substantial amount of money, but I thought I'd bring that up as an option to see if you'd be interested in participating in that. It's just a fundraiser for the Center of Hope and I'm not sure the details about, I know the mayor knows a little bit about it.
That's a fairly accurate statement. My wife is on that board, and she is working diligently trying to find people that will sponsor tables to various levels and whatnot. So I would have to recuse myself from voting. I've got way too much pressure at home. But I think it's a very worthy cause, and I think the information that Chief Broadhead gave us this evening demonstrates that fact. So if the council did choose to support that effort, well, I certainly would be supportive of it. But other than that, I'm not going to go any farther than that. So, but it is just strictly a fundraiser, and perhaps Martin or Councilman Canan has some information on that as well. I don't know.
Yes, sir. I'll be honest with you, sir. They had a meeting that either I forgot about but I think that the last I heard, unless they've changed, they're still talking the 23rd of October.
I think that's accurate.
And they were still soliciting. I don't know if they had finally decided on. They were talking about if you were a sponsor at a certain level, what benefits you would, how many free tickets you would get for your organization. I'm not sure if they finally came out with that, but I know they were looking at the 23rd. They were looking at table sponsors. They were looking at silent auction items to be auctioned off, and about a $35 to $40 range because they wanted to keep it at a very family-friendly type event. They didn't want to get into where people didn't feel that they could bid on a $2,000 or $3,000 silent auction item, so they wanted to keep that. They were going to have face painting for the children, games for the children again, because they wanted to make it into a family event. But I'll definitely see if I can dig up some more information if they've come out with the various sponsor levels and what they're doing there along those lines.
I think that'd probably be appropriate for us to get a little more information on it, and then at the next council meeting where we can decide if we want to go that way or not. Anything else?
No, Your Honor.
Okay, thank you. I guess the only way I know to get more tourists from Jackson, as Councilman Larson was talking about, is to get that big statue of Marilyn Monroe out Palm Springs. If we could get it downtown, we'd have to do it. But that idea didn't go very far, so. Okay, we had an FCAG meeting last Thursday, and we're still in the process of trying to find an executive director for FCAG. And so I don't know how that's going to go. It seems like it just goes on and on, these issues, but it's my understanding we've got 5 or 6 new applications, so hopefully we'll get a new director there. And other than that, I really don't have anything to report. I think I don't remember when Mr. Butterfield and I went out to the casino and had a meeting. I don't remember when that was. That was kind of an interesting meeting. And we got to meet Stephen Fasthorse and Sergio Maldonado and some of the tribal members out there. But anyway, I hope you enjoyed that.
Your Honor, I did. I appreciate the opportunity.
Okay, good. Okay. Do we have an executive session this evening? I was afraid that we did, seeing our attorney sitting back in the background glaring at me. So, Chair would entertain a motion to convene into executive session for the purpose of personnel, considering the appointment, employment, right to practice, dismissal, complaints, or charges against a public officer, professional person or employee in accordance with Wyoming Statute 16-4-405 AII, and for the purpose of considering offers, tendering wages, salaries, benefits, or terms of employment during negotiations in accordance with Wyoming Statute 16-4-405 AX, and litigation, considering litigation to which our governing body is or may be a party in accordance with Wyoming Statute 16-4-405 AIII.
Motion to adjourn into executive session.
Second.
Been moved and seconded. All those in favor signify by saying aye.
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 Opposed, same sign. Mayor votes aye. Motion carries. Reconvene into regular session.
Your Honor, I'd move to reconvene into regular session.
Second.
Been moved and seconded. All those in favor signify by saying aye.
Aye.
Opposed, motion carries. There's no action from the executive session, so I would entertain a motion to adjourn the regular council meeting.
Your Honor, I'd make a motion to adjourn.
Second.
Moved and seconded. All those in favor signify by saying aye.
Aye.